let's talk placenta. How important it is to do something with the placenta?
Postpartum.
Yes.
It's arguable, right? Some people are like devout, like you should encapsulate it, you should make a tincture out of it.
Correct.
You know, spiritually, some people don't do that, but they bury it, and there's a ceremony for that, right? And then some in the hospital, you don't realize that when they cut the cord, right, at birth,
Yes.
how much blood do they leave in the cord? How much blood do they rob of baby?
That's another topic. We're gonna touch on that.
But
Okay.
what I'm letting you know is that the placenta is often just discarded. Right? It's discarded. Why? It's not discarded. It's not thrown away. They keep it, and they use it, and they sell it.
For what?
I don't know what they do it for. Different reasons.
They sell it.
Well, why did they sell other body parts?
Like
The cord blood, right? The cord blood is not there for, like, it's sold to companies, and the cord blood is used for stem cells for therapies, but that cord blood is for your baby, right? Delayed cord clamping is so important because 1/3 to 40% of the blood is still left in the cord placenta.
yeah. So once a woman gives birth, right, you've got this umbilical cord and the placenta, and something stays in that placenta, and through that cord, all the good stuff comes through that cord to your baby. So it's recommended now, when you give birth, you don't cut the cord right away. You wait for half an hour or even an hour.
You wait until it stops pulsating.
So the cord is pulsating.
If mom delivers the placenta and it's left, and then you see the cord on baby and you don't cut the cord, because we did delayed cord clamping for my kids, right? And like you can literally watch the placenta continue to pulsate blood into your baby, and then when it stops, that's when the midwife says, "You want to cut the cord?"
It's legal, it's normal practice in a regular hospital. You can say that I would like to do that, and they will do it. Or they will force you to cut the cord.
They won't necessarily force you to cut the cord, but they may find something wrong with the baby that keeps them from actually being next to you, right? There may be a reason that they have respiratory distress, or there may be a reason that they have to go to the NICU. And if they have to go to the NICU, they're going to cut the cord, right?
What's the NICU?
The NICU.
What is
Neonatal Intensive Care Unit. So some babies are born and they need some sort of, life support or something, right? And so sometimes they cut the cord, sometimes before even getting to mom. Right?
Oh.
So placenta on this side, right? Just to say, like, in terms of encapsulating, in terms of tinctures, some moms, some midwives, some birth workers, they swear by it in ways that are, like, I think ancestrally driven, meaning generationally women have done this.
They
and
add the placenta.
They encapsulate,
Yeah, but back then. Now they encapsulate. You can do it for a few $100, right?
Yeah. Yeah. Do I believe in it?
Yes.
My wife did it both times. No, my wife did it the first time, and the capsules were a little too strong for her. She noticed that they did help, like they did influence her hormones. Some moms know.
It helps recovering, right?
Helps with recovery,
Okay.
helps with hormone regulation, helps with their body's ability to heal naturally in the postpartum phase. I'm hugely a supporter of doing it and seeing if it works for you, as
But you said they were too strong? How did she feel it?
For my wife, she could sense that her hormones, it was just too strong of a response from her body. I don't know if it was heat. I don't know if it was headaches. I can't remember what it was. For some moms, it's not always, like, there's different ways to actually do that. So some say tinctures is a way that you can dose it differently. Some just eat it.
And if it's tincture, for how many days or months do you take it?
I don't have a recommendation on that. You'd have to ask, like, a more experienced, like, birth.
So you tell it to a doctor and they kind of packet the placenta?
No, they will. You have to.
They just give it to you? And
So you go to the hospital and you would hire, like, a doula. Like, if you have a doula, or if you have somebody who's, like, most doulas also do placenta encapsulation. And so if the doula's already there,
I got
the doula will literally have an ice chest. And they will take the
really?
placenta with them, and then they will do all the preparation.
Placenta is an organ? That's why you have to have it in an ice?
The placenta is an organ. The woman's body makes a placenta. 60% of the research said that 60% of the placenta is actually made because of the male contribution, which is interesting, right?
How?
Because how many women build placentas when they're not pregnant?
Okay, but why 60%? So it's,
Oh, I don't know where the genetic research comes from,
okay,
but
so
that's just some of the research.
what's
I've
inside
done.
that placenta that is critical for a kid to get it via the umbilical cord? What's inside of it?
So the placenta is essentially taking virtually every aspect of mom and nourishing and growing the baby. So babies, when they're born or when they're in utero, they're not breathing, right? They're not eating. They're not digesting. They're just like the cord through their umbilical
Correct.
cord is literally nourishing and growing their whole body. So I would say more than anything, it's blood, right?
And all
And
the
all
good
the
stuff.
nourishment in blood, but stem cells. Stem cells by far are why science wants the cord cut and they want the cord blood, and cord blood banks exist because then they can take the stem cells and create therapies out them, right? Because we're hearing about that. Stem cells for low back disc
Correct.
issues, stem cells for knee arthritis, stem cells for, that's where it's coming from. It's coming from your baby's blood.
But you can freeze those stem cells for your baby, right? If he needs it in the future, somehow.
I think you can, and I would say, why not give it to him on the day one? Right?
Just from the placenta?
Yeah. Why wouldn't you? Oh, you mean from the placenta?
Correct.
I would say necessarily. I don't think babies take placenta. I don't think that's something that you give babies.
Yeah, but you can do something with the placenta just to get the stem cells from that placenta and to store them. If your baby needs them once he gets, let's say, 12, 18, 30 years old,
I didn't know
he's
that.
got his own stem cells right from the birth.
Yeah, I didn't know that. I think that's great. I think that's a great use of science.